Hello and welcome to Wellness Wednesday. I'm James Curry with the Communication Department here at MCHD, and I'm talking to Renee Grimes. She's an RN, that stands for Registered Nurse, and she's with the Alabama Hospice Care of Mobile. Renee, thank you for being on Wellness Wednesday.
Oh, I'm glad to be here.
And the reason why you're here is you and I go to church together, and that's how we were able to facilitate this. So again, thank you for your time. So you have a very long career as an RN, and half of that time you have spent specifically as a hospice care RN, hospice care nurse. So can you just tell me a little bit of, people may not know what hospice care is. So if you can just kind of give us an overview.
Okay. Hospice is a service that's provided for people with terminal prognosis or a life expectancy of 6 months or less. And that's determined by a lot of guidelines and your physician. The services that we provide include many things. Some of the things that we cover are the disciplines that come into the home, the skilled nurse, chaplain, social worker, hospice aides, and volunteers. We also provide medications to cover symptom management. That's the thing we specialize in is pain and symptom management. We provide spiritual support for the family, emotional support, and the physical support. So it is a holistic approach to the patient's care. In order to get hospice services, the physician will give a referral to the hospice, and then the hospice will evaluate and see what's appropriate for the patient.
Now, we don't offer hospice care here at the Mobile County Health Department, but we do have several, physicians that have patients. And, it's one of those things that could possibly come up in discussion where, the patient and the patient's family, obviously, they need to discuss this level of care, this level end of life care with their physician. So, it's important to know that, for someone to be able to speak to their provider about this and understand what it is. We talked earlier about it that sometimes people think that they have to contact hospice at the very last minute, and that's certainly not the case. So the reason why the 6 months out is for you all to be able to establish a different care regimen, like you said, pain management and all the other services that go along with hospice care. So can you kind of provide a little bit more insight on that?
Well, once a referral is given, the hospice nurse will go out and evaluate. We'll have the medical records from the physician or recent hospitalizations to review and to help to determine, along with the physical assessment, to see how and why the patient qualifies to be on the program, based on Medicare or insurance guidelines. And once that care is established, the registered nurse will develop a plan of care with the patient and the family, and it's based on everybody agreeing to the plan of care. Because if the nurse decides the plan of care and the family or the patient don't agree with it, they're not going to do it. So it's very important for everybody to work closely together to take the best care of the patient possible.
Yeah, what was very helpful for me personally, and my father was on hospice care here at the end of his life. We were provided a booklet that was called "Gone from My Sight," and it was just very helpful for us as a family to be able to anticipate some of the stages that we would be experiencing with my father. Not necessarily that the book was a guideline like, okay, this is going to happen in week 4, and this will happen in week 3 and 2 and 1, but it was good preparation, I guess, to, so to speak. So we would understand that the changes where they were extreme or subtle, it was very helpful for us.
Right, that's very important. that's one of the things that we really focus on is educating the family and the patient and helping prepare them to to be able to handle the stages as they come up so that they're not so afraid and that they understand that these changes are to be expected as a patient declines and how they can call the hospice nurse and, with any changes so that we can assist them in how to manage those changes or signs of decline.
Yeah, it's not a 9 to 5 kind of job. I know that for a fact, from living in it for 2 months. There were several times that we contacted our nurse on call at 10:30 or 11 o'clock at night, and they came out, they assessed, they brought medication. So, these are services that only hospice would be able to provide for home care. So we were very, very grateful that we're able to have that service. But aside from that, um, there's specialty equipment that's required to care for a hospice patient. They may need an oxygen machine, or they may need a hospital bed, or they may need a walker or a wheelchair or something like that. So all of that equipment that is anticipated to be needed is also provided with the hospice care too, right?
Exactly. Yes, that's one of the things about the oxygen is that to be on regular home health or be on oxygen, you have to have an oxygen saturation level of below 87% to qualify to be on oxygen. But with hospice, the only qualification is that it makes you comfortable. So if it helps to make you comfortable, you can have it. We don't base it on the physical signs of what you need. We base it on what makes you comfortable. We provide, any kind of medical equipment like hospital bed, overbed table, like you said, the walkers, wheelchairs, Hoyer lifts, whatever that patient needs to be as comfortable and as well cared for as possible.
Now I've got some notes here of my own here. Let me read. Hospice care is a type of healthcare that focuses on palliative care, which is quality of life, and of a terminally ill patient's pain and symptoms, and attending to their emotional and spiritual needs at the end of their life. And just like we mentioned, you all prioritize comfort and quality of life. We spoke about also too that you look at the medication list that the person is on, and you're able to determine which medications this person actually really does need here in this last 6 months, and which they may not need. But 6 months is not a guideline like we spoke about. We mentioned, and you told me that sometimes after medication is assessed, that the person actually lives maybe another year or a year and a half or a couple of years after that, right?
Right. The 6 months is based on the criteria for admission. But once a patient is admitted, there are two 90-day certification periods. Then there's an unlimited number of 60-day certification periods. But at the beginning of each of those 60-day periods, the nurse practitioner or the physician has to do a face-to-face visit with that patient to determine if they still qualify to be on the service based on their ongoing condition. And that's a requirement of Medicare. So, you can be on hospice for extended periods of time, but it's based on the assessment of the nurse practitioner or the physician to determine that you still qualify.
Mhm.
And sometimes, if the patients determine that they don't qualify, that can be challenged, and Medicare will review it and based on the medical records. And if Medicare doesn't agree, then you can't discharge them and you have to keep them on the service.
Mhm.
Of course, that's fine too, because we don't want to discharge patients, but
Oh, no.
we want to make sure everything we do is appropriate for the patient.
Yeah, absolutely. To switch gears here just a moment, you talked about some of the other services and some of the other people that are involved other than not necessarily a medical person. You've got social services, you've got spiritual health. you know, where you have a pastor or a spiritual advisor. Um, and we were afforded all of those services as well. We had uh, each of those individuals, other than medical people, come by my parents' house too, which was very helpful for us as a family. So it does take a team, and I have realized, you know, it's a calling. It is a special type of person that can be in this position. And gosh, Renee, you know, I'm sure you've sat in situations where you've held someone's hand and seen them draw their last breath. I mean, gosh, that's that's I can't even describe it.
Well, I've done that many times, and it's just a special time, you know, to just be there for the family and for the patient as they transition. And
Mhm.
it's, you know, it's emotional for everybody. And I've always told the new nurses coming on, it's okay to cry. We're human. We can cry. Just don't cry more than the family does. Stay in control.
Yeah. Well, you know, for anyone that you know is seeking, you know, to be able to speak to someone beyond the services that hospice provides, you know, we have behavioral health providers here at the health department. So if someone just needs to get a different level of you know, a counseling other than just sitting with a social worker or a spiritual advisor, you know, they can certainly contact our behavioral health people here at the health department. uh, if they just need a little bit more one-on-one time with a provider. You know, that's a service that we do provide here, and you never know when it's needed, but you know, it's there. It's there.
Very good.
Well, Renee, anything else you would like to add that, you know, would help maybe dispel some of the, you know, stigma about, you know, hospice care?
Well, one of the things about is very important for people to know is that hospice does not do anything to hasten death. We do not try to make it, you know, to extend life or to shorten life. We're there specifically for comfort for that patient and support for the family. A lot of people are afraid they go on hospice that will over medicate or things like that. And there's strict guidelines and about how the patients are medicated and cared for, and hospice does not shorten the life.
Mhm.
Another thing is that hospice is for all people, and it's for all ages, and it's for people with many different diagnoses. A lot of people believe that it's for cancer patients. Well, it's everybody that lives is going to die one day, and they have the right to be treated with dignity and respect and comfort at the end of their life, no matter who they are, what their age is, or anything like that.
Yes, absolutely. And again, it takes a special kind of person. And I know you're that special kind of person. And, you know, nursing, starting way back with Florence Nightingale, you know, nursing is a calling. And thank you so much.
Well, thank you.